Based on KK's communication profile, KK's most urgent communication needs at this stage will be prioritizing the communicative functions request, make choices, reject, and showing using gestures as communicative means. These skills are importantly for her to express her needs to her parents or to her teachers at schools. And for skills that are foundational for later speech and language development, there will be turn taking, gestures, vocalization, joint attention, and imitation. As for skills that should be addressed before direct speech or language training, it will be joint attention, initiating and responding, and imitation. And also gestures like pointing that are more explicit, like open palm, for communicative function is functional and conventional. Also, some didactic gestures like request should be developed around 10 to 13 months, but is not observed in the video. Requests will allow one to express their needs and wants. For reject, it's like waving hands to indicate no. It's more conventional and an appropriate form for rejection. Also, there's eye gaze. It is for responding joint attention, and because it is current response, there's low gaze detection for ASD.
We have evaluated different intervention options, and we come to a conclusion that we'll use a hybrid approach using more than words in Hannon's program and Jasper. We have also discussed PEGs, which use concrete symbols targeting communicative function requests. And as observed in the video, KK screamed when chips are being taken. This shows her communication intent, which is protest, and PEG serves as a form for KK to express her communication intent. PEGs also fulfill her functional needs and, in the long run, facilitate development of verbal language. However, we have found that there's drawbacks, such as KK's father indicated the wish for focusing on speech, and also there's candidacy consideration, such as like right now, KK is able to express her needs using protesting, rejecting, screaming, despite not being conventional. Others seem to largely understand her intentions, so she may not be a good candidate for PEGs. And also, we'll focus on using gestures like open palm and waving hands that is more conventional and targeted instead of picture exchange. We have also discussed More Than Words Hannon program. It targets at parent-child interaction, empowers parents to support their child's social communication during fun, everyday interactions, and create opportunities environment for communication intent and also express needs for social pragmatic growth. The reasons why we choose More Than Words in Hannon program, as it is a family-centered focus reflecting a naturalistic approach, and also there's an optimal setting provides opportunities for the child to practice existing skills and learn new ones. And also the strategies of social interactionalist model of language intervention is to wait for the child to initiate, such as focus stimulation. As observed in the video, KK showed interest in other toys nearby, can follow KK's needs and jointly select and repeat language goals within interaction. However, there's also some concerns, such as the age appropriateness, as More Than Words aim at children under age 4, and it requires to follow child's need, which might be difficult, and Hannon might not show clear leads on initiation. And it also relies on parents, which might increase parents' burden.
As for joint attention-based intervention, we have discussed using Jasper. So it's tested in RCT for ASD children, and systematic review showed efficacy for improving some joint attention, joint engagement, play, and language outcome in ASD children. And this can also be implemented by parents and clinicians, aiming to promote communication and behavioral development under natural environment. So we are targeting joint attention, symbolic play, engagement, and regulation. So first of all, for joint attention, KK is highly motivated by sensory play like bubbles as observed in the video. She showed 1 to 2 occasions of responding to joint attention, but there's no initiating joint attention observed from the video. So intervention begins by joining the child's to their preferred activity, which can be bubbles, which will help enhance joint attention, and this can be generalized to longer duration of joint engagement with parents or caregivers, and also of course with the clinician, and this will pave the way to improve social interaction, expressive and receptive language abilities. For symbolic play, we aim to increase diversity and flexibility in play to reach higher levels of play, because right now KK mainly demonstrated functional and exploratory play, and through Jasper, clinician can systematically model and scaffold the next step in play, which helps her to reach a higher level of symbolic play. For engagement, through play and activities, we hope to promote positive interaction between KK and others, and this promotes social interaction and also to help her to develop affection, which is on the communication matrix level 4. And for regulation, KK mainly protested by screaming, which is not really conventional and appropriate. So we hope to manage her frustration by self-regulation, by teaching some request and repair. So since this approach aligned with KK's mother's preference of using joint attention-based intervention, this is a good approach. But the drawback is that no expressive language component is targeted by Jasper, which doesn't align with KK's father expectation.
So next, I'll talk about how to address the parental perspectives. So in response to the mother's interest in joint attention-based intervention and the father's wish for speech-focused therapy, we will consider 2 points. So first of all, we will focus on parental education about developmental priorities, which we will explain how prelinguistic skills relate to future development of verbal language. So the prelinguistic skills, including gestures, turn-taking, vocalization, joint attention, they all play a crucial role in developing verbal language. While prelinguistic skills and verbal language share similarities in use and content of language, the difference lies in the form of language, as prelinguistic skills are more concrete. Prelinguistic skills are also developed first and are the direct developmental precursor to verbal language. The second point we'll focus on is managing parents' expectations. So we will explain how we might start the next level once we see improvement in KK's most urgent needs. So which KK's most urgent needs are to increase her communication intent with others and also to catch up with communicative functions such as to request to lay a robust foundation for later further speech and language development. So using the Jasper aligns with KK's mother interested in the joint attention-based intervention, and our intervention will mainly target at joint attention, symbolic play, engagement, and regulation, which we can teach KK and fulfill maybe part of her parents' expectation as well.
Regard the father's wish for speech-focused therapy. Verbal language is the most abstract form of language, which requires more prerequisites before mastering those skills. However, referring to KK developmental profile, it will be hard for KK to start training verbal language directly. If the intervention target is too advanced, it may even suppress her communicative intention. The most urgent communicative function needed now a request, reject, joint attention. Yet we notice that KK's father may wish to focus more on KK's verbal language, so we would suggest a hybrid approach of implementing the Hanan program at home for NN, which mainly focus on increasing the exposure and language input. And there is adequate research prove that adequate language input can actually facilitate the verbal language at a later stage. And then fathers may also worried about if
the nonverbal intervention will worsen any reliance on nonverbal means. Regarding this concern, our approach could help KK to build the nonverbal skills like gesture to prepare her for later verbal language stage. We will also point out that teaching prelinguistic skills like gesture will facilitate later verbal output. So it's not an alternative, but an assistive act. For the short-term functional gains, aims at initiating and responding to joint attention. Secondly, eye gaze for responding to joint attention. Thirdly, requesting and rejecting by using conventional and appropriate gesture. Fourthly, play skills, for example, like symbolic play. We believe that it may be within her zone of proximal development. For the long-term developmental outcomes, firstly, we aim at stronger reciprocity and social interaction. Secondly, play skills, for example, associative or cooperative play, like engaging with others. And thirdly, receptive and expressive language skills at the ultimate stage.
Moving on to the intervention plan, so based on the observation and goals we set just now, we would put a primary focus for the intervention at this stage will be some language content uses were observed in KK, but they are not expressed in a conventional form. So we would target on helping KK to express her intent by a conventional and non-verbal form, which is gestures. So since we are paving the way for verbal form, we would adopt a hybrid approach with Jasper and Helen program. Jasper approach is to help KK to establish prelinguistic skills with the following short-term goals. So firstly, open palm for request of an object, pointing for choosing between objects, initiate joint attention, eye gaze for response, shake hands for reject, and also some symbolic play skills. As KK's father expressed his preference on speech and language development, we will explain our clinical decisions to why we focus on the mentioned prelinguistic skills first. But then afterwards, we will also deliver Helen program to caregivers and explain its rationales, which is to increase the dosage of language input in daily life, which can also help paving for future speech and language development. As shown in different research, the increase of language input can lead to language output as well. So Jasper sessions and therapist led to directly address the initiate joint attention explicitly. The Helen program will be implemented by parents after being coached by clinician. Observe, wait, listen strategy will be used to create more communication opportunities to daily routines. Thank you.